It is an essential service for sure. Okay, thank you so much, Greg. Greg Harper reporting in Coquitlam. 11 more people have died in BC from COVID-19 since Saturday. In total, 69 people have died in our province. 45 new cases were reported in the past 2 days, bringing the total to nearly 1,500. More than 900 of those have recovered. Provincial Health Officer Dr. Bonnie Henry says there are 137 people in hospital, 58 in intensive care. Dr. Henry downplayed complaints about people defying orders, saying the majority in BC were complying. She does not think stronger restrictions are needed at this time.
It is so important for all of us to keep going with everything that we are doing now. It is holding us, it is holding our line, it is allowing us to deal with these issues in a way that is the best that we can do for our province. And I'm asking you as well to please keep on the line, hold that line, keep doing what you are doing. And especially for our youth and our young people and our children, remember, this is not forever, but it is for now. And what you're doing is making a difference.
And Dr. Henry took the time to thank Alberta yesterday for donating personal protective equipment. She says BC has enough to meet our current demand. Health officials in BC will be releasing updated projections on Friday. Canadians appear ready to play it safe when it comes to easing tight restrictions aimed at beating back the COVID-19 pandemic. A new Leger poll suggests 29% of us think work and leisure restrictions should only be lifted once the country is free of new COVID-19 cases for at least 2 weeks. 98% of those asked say they are following rules on social distancing. Until current restrictions are lifted, 40% say they would report someone who is not obeying public health rules. Well, most Canadians appear to be following public health guidelines. Video of a rally against social distancing is sparking outrage. A group of about a dozen people gathered outside Vancouver City Hall yesterday, intentionally breaking social distancing rules. One person was holding a sign that read "fake news." The man behind the video calls the lockdowns and quarantines unlawful. A longer video of the gathering was removed by YouTube. BC's health minister says it's important to steer clear of COVID deniers and keep flattening the curve.
You know, I think we've seen in the past number of weeks 1 or 2 examples of people behaving very badly. What I'd say to people is focus on what we need to do together, and don't allow people who are attempting to promote themselves by using the suffering of others.
The Vancouver Canucks are asking staff to take a 20% pay cut as the team tries to save where it can during this pandemic. According to reports, all full-time staff have been asked to volunteer for the wage reduction. In normal times, the regular season would have wrapped a week ago. The Canucks can tap into Ottawa's wage subsidy program and will likely do so to help cover salaries. What's it like working on the front lines and then coming home to be with your family at the end of the day? Reporter Tina Teneriello catches up with a mother living with a respiratory therapist, a nurse, and her 6-year-old son.
Usually I come home, the first thing I do is hug my son, but now it's like, if he comes to me, I have to stop him. And it's like, well, daddy's dirty. Daddy just came from the hospital.
Frontline healthcare workers not only have to worry about their own safety amid the COVID-19 pandemic, but also the health of the family members they live with.
Every second, every minute, I have to check my son. We don't do that often, every day. But of course, every time I always ask him, are you okay? You have fever, you have a stomach ache. It's just a paranoia.
Tene Rose de Adante lives under the same roof with her sister, who's a nurse at the Montreal General Hospital, her husband, who's a respiratory therapist in the ICU at the Montreal Royal Victoria Hospital, and their 6-year-old son.
My only concern is my little nephew because he's more at risk. But we are trained not to, in our work also, that we should never wear uniform outside.
These health experts say it's important for frontline workers to remove and wash clothes when they get home, clean shoes and shower before you get close to any family members.
Literally all my clothes at the front door, place them in a plastic bag, and then I literally, first thing I do, just in my underwear, run straight to my shower.
They say for now the situation is manageable, but they fear if the curve grows and they run out of protective gear, they and their families may not be safe.
I am worried that there may come a time where we may not have the equipment available, and I'm at such high risk performing like high risk procedures like extubations, intubations. I'm right at the airway of the patient. I have like direct access to lungs where most of the virus it gets developed, or where the virus is.
The thought of living separately to protect each other is constant.
It's hard to think about just being away from the family, but at the same time, I don't want to stay here and contaminate or infect any of them. There's always that chance where I could get the virus, and I'm worried at that time, where can I go? Where can I stay?
In Montreal, Tina Teneriello, City News.
It is 9:07 now. People who rent out illegal suites can still get financial help if they need it. Clarifying its stance on its rental subsidy program, the province says both tenants and renters can still get money through its COVID relief program and don't need to worry about a visit from bylaw officers. This comes after a tenant in an illegal suite expressed concern about his landlord refusing to fill out a subsidy application. As small businesses struggle to survive during the pandemic, one local store is having to deal with an additional blow. On Thursday, thieves smashed a window and robbed the Eternal Abundance grocery store and cafe on Commercial Drive. The owners say the tills were sawed off and taken. Also stolen were debit machines, a laptop, and delivery tablet. There has been overwhelming support from the community since the robbery. People have been shopping more and ordering more online.
And then on Good Friday, we actually had this surge of people coming in because they'd heard what happened. We also do a grocery delivery service, and so we've seen a spike in that, just people having heard what happened, people sending their condolences. We even had a lady call in from northern BC saying your laptop got stolen, I can buy you a new laptop. And I said to her, I'm not we're not a charity. I really appreciate the offer. That's very generous of you. But why don't you just order from our online store? We'll ship it to you so you can at least have something in exchange. So. Yeah, there's been a huge time of support, I think, because a lot of people see that small businesses are suffering. So they're really getting that it's really important to support the places that are still open.
And the owners say any help is welcomed, whether it's customers arranging a grocery pickup or delivery, or even buying a gift card for a friend. Well, if you're not sure how to talk to your kids about COVID-19, a new storybook aims to help children understand and come to terms with this new reality. David Zura catches up with the author, a family physician who wrote the book for her daughter.
They may cough and sneeze.
How do we talk to our children about coronavirus? There's a lot to understand, and young kids may find it difficult articulating what kinds of questions they want answered. Well, a local physician found herself whipping up a children's book to help her answer questions for her own daughter, and now she's sharing it with other parents. Dr. Mabey, can you tell us a little bit about where the actual idea for the book, this book right here, came from?
It came from my 5-year-old daughter. I could tell that she was overhearing what my husband and I were talking about with coronavirus and hearing us talk about the number of people dying and the death tolls and that sort of stuff.
What's happening here?
She says she didn't realize how much her daughter Emma was absorbing until a family game night of 20 questions.
And she said she was something that could make people really sick. And then I ended up guessing that she was the coronavirus.
How important is it to take some time with our kids to have these conversations that we don't even realize are sort of bubbling on their minds?
Yeah, I think it is important because I think it will come up in other ways if we don't actually take the time to sit down with them.
How did it go from being a discussion over a game to becoming a book?
Because I like to doodle, and usually when Emma and I are talking about things that we're worried about, then we usually draw pictures of it.
Dr. Mabey says the whole project was really very low-tech, writing it out on a word processor, pasting the doodles onto the pages, and taking photos before popping them into a PowerPoint to be transformed into a video.
You also need to know that you will always have people who love you and take care of you no matter what happens.
She says she did have some help from a pediatric nurse practitioner, a psychologist, and her husband, as well as a couple fellow parents. The video version of the book is now available for anyone to watch on YouTube. She's urging parents to watch with their children so they can be ready for any questions their kids might have.
When they've got a trusted grown-up or their mom and dad to talk it through with them, then at least you can face scary things better together.
Any plans to author any more children's books in the future?
We'll see.
To watch the video on YouTube, follow the link we put here on the screen. In Surrey, David Zura, City News.
Thank you so much, David. Great story. It is 9:12 now. We're going to go to a live shot in Ottawa where federal ministers are making another announcement. Let's listen in.
Arrive in Canada.